everybody!
What the hell is that?
Oh my God!
You saw previously on my channel that I reacted to Family Guy, but you guys have been requesting right and left that I waste no time and make a part 3. So today I'm going to be taking a look at some of the strange and crazy medical type situations from one of your all-time faves, Family Guy. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy what you see here on this channel, smash the subscribe button and turn your bell notifications on. That way, you learn when I post a new video. All right, let's dive right in. Oh.
Stay. Sorry, I couldn't find a sitter.
Okay, wait a second. So there are actually dogs that can go into the hospital. They're basically like companion dog that somebody has to have. They can actually sometimes be admitted to a hospital. Sometimes depends on your hospital.
You all have the flu, but luckily you got here in time.
Doc, this is very important. How long before she can make dinner again?
That's messed up.
Peter, you appear to have a very strong immune system.
Sometimes people will be around a lot of sick individuals and not get sick. I, for myself, right, being that I'm an emergency room doctor, I'm always around people who are sick, and I very rarely ever get sick.
Anyway, this flu season has decimated the hospital and we're severely short-staffed. How would you like to be a male nurse?
Do I get to wear those green pajama clothes all day?
Yes.
Yes.
I'll do it!
So he's going to be a male nurse without any training.
Give me 20 cc's of Music Factory. Clear! Again, clear!
These are your defibrillator paddles, okay? Most hospitals nowadays actually have electrode pads that just stick to the chest instead of paddles, but some places still have the paddles. And if somebody's in cardiac arrest, there's pulseless, and they have a rhythm that is shockable. You don't shock everybody. Typically, there's only 2 rhythms that you shock. VTAC or VFib when they're pulseless and unconscious. So he did 3 shocks in a row. That is actually an old protocol that's not used anymore. Typically, it's 1 shock CPR for 2 minutes, recheck a rhythm, and then also typically you're using epinephrine at the same time every 2 to 3 minutes.
Lois, I weigh the same 293 pounds today that I weighed in grade school.
You can actually weigh the same amount, but actually have more subcutaneous fat, right? Because fat and muscle weigh different. So you can be 293 pounds of all muscle, but you can also be obese because of the amount of subcutaneous fat that you have and even organ fat that you have.
Perhaps it's this lump on the side of your neck, sir.
Oh my gosh, it's kind of really lateral on the side of his neck. So it could be like an aneurysm, it could be a mass, it could be cancer, it could be a lipoma, which is a fatty tumor.
We gotta go see Dr. Hartman right away. I think it might be a tumor.
Okay, let's have a look. Oh, yes. It appears you have a subcutaneous vestigial twin growing on your neck.
There are things called teratomas that are remnants of hair and teeth that are found in the body, typically in the abdomens, but could be somewhere else in other tissue. But this weird twin that's growing on his neck, unlikely.
Hi, everybody!
What the hell is that?
Oh my God, it's a little me!
That is awesome. Okay, I've never seen this in real life. You would never just go in and just cut this open. You would probably end up starting with a couple different images. You might do an ultrasound, you might do a CT, and then for soft tissue things, you get an MRI. An X-ray is probably useless in this situation. And then once you determine what it is, you may want to open it up and see what potentially is on the inside.
The fertilization device is complete. This will impregnate me with the child that will bring Brian and me back together. First, I add Brian's hair and saliva.
Hair and saliva, good, right? It's got some DNA that you can extrapolate somebody's DNA from.
Yeah, you watch me, bitch.
Gosh. What? You can't just inject straight into the abdomen. There's no place then for the baby to develop. It needs to be inside a womb. And what the womb is, it's the uterus. And typically a uterus is an organ that is in a genetically made woman. Probably unlikely this young boy doesn't have a uterus. I don't know if he does or not, but genetically he shouldn't.
Oh my God, that thing's positive. Is Lois pregnant again? What have you done?
I think you mean, what have we done, Brian? We're pregnant.
Oh my gosh.
God!
The urine pregnancy test tests for beta HCG or HCG, which is human chorionic gonadotropin hormone. And it's actually most of the time released by the placenta. It could also be released by the pituitary gland, colon, liver, because sometimes a man can actually test positive in a pregnancy test, but it typically doesn't have to do with pregnancy. It could be concerned for like a different type of cancer. Not too far-fetched that STEWIE can potentially test positive on a urine pregnancy test.
You look ridiculous like that.
Too ridiculous for you to put a baby in me.
Okay, Raylene, I'm Dr. Hartman.
Let's see where this actually goes, because STEWIE doesn't have the female genitalia.
Your vagina seems to have a penis and 2 testicles.
Oh, right. I
There you go.
sneezed real hard and all that came out.
Ah, that explains it.
He sneezed really hard. It doesn't typically work that way.
Could you do that thing where you take some fluid and tell me if it's going to be an imbecile or a creep?
There's actually procedures that the doctors can do, amniocentesis, to identify things earlier. Typically, they do these to make sure that genetically the baby is okay, that there was not any inborn errors that they would be concerned about, any chromosomal errors, that sort of stuff. There's always a potential risk of causing a miscarriage or infection when you do these procedures, but very, very low, and people typically do them.
Oh my God, what's happening
Heart
to him?
attack.
I'm having a heart attack! You ought to know by now!
Somebody's having a heart attack and they become unconscious, you need to check for a pulse. Heart attack typically means you're having a blocked coronary blood vessel. Cardiac arrest, meaning arrest, no movement, so the heart has stopped. That's when you need to do CPR.
Oh my God. Is my father gonna be okay, Dr. House?
He's in a coma, Mrs. Griffin. Listening to the sound of your voice, I'd say he's the lucky one.
This is Dr. House. So if you guys want me to react to Dr. House, let me know which episodes, which shows that you want me to react to.
Dr. House, if you're gonna save this patient, you'll need this.
Get this thing out of my sight!
Okay, so you know Dr. House, if you've ever seen any of his shows, he just does things the way that he wants to do.
My methods are a little unorthodox, Mr. Griffin, but I think I can help.
What are you doing?
My job. Sometimes people fake being in a coma. This man's not.
Okay, that's funny. We do get a lot of people that actually fake being in comas or fake seizures, but actually as part of our exam, there's something called the Glasgow Coma Scale, and one of it has to do with response to pain. Eyes are closed and you're like, oh, are they just totally unresponsive? You typically do something called a sternal rub, where you actually rub your hand onto the sternum. That hurts a lot. You can push in the nail bed, that hurts a lot. So there's little different areas that cause a lot of pain.
What you talking about, Phyllis?
Gross, he's getting his nose period.
Peter's references to a nose period is totally inappropriate. People could potentially die from a nosebleed because the nosebleed occurs in 2 different areas of the nose. One's in the front, it's a septum, which is called Kesselbeck's plexus, and the other one is actually a major blood vessel in the back. And if that is open and bleeding, you can actually bleed out because it's so hard to know where the bleeding is coming from, and it's hard to get the bleeding to stop. To stop the nosebleed, pinch the nose, lean forward. Don't push your nose back. There's a type of Afrin, is a name brand, but phenylephrine up the nose. It's a spray to constrict the blood vessels. You can actually still use liquid cocaine. There's liquid cocaine at the hospital, but it's not anything that you would think.
I'm sorry to inform you that Brian has a brain tumor.
Oh no. You can have a tumor in the brain or actually even like skull fractures that can cause bloody noses as well. That's a lot more serious and dangerous in the sense that now there's a communication between your nose and your brain itself, increased risk for infection.
So, Doc, how much Jamba Juice do I have to drink
He's
to
still
cure
intoxicated.
this? I've also heard that, like, crystals exist.
Crystals work on the idea potentially of healing powers, but most of the time it's probably more related to a placebo effect. Do you use crystals? Let me know in the comments.
Well, I say we get that tumor out of him right away before he gets any dumber.
So if Brian doesn't have the surgery, will he be all right?
No way. I'm never going back to my old self.
Brian could have the surgery and be smart again, or he could skip the surgery and stay dumb like this.
Okay, so the concern is not that Brian will stay dumb. He's not dumb. It's a brain tumor pushing on his brain. It could continue to expand. So you want to address the swelling of the brain, and if there is swelling, it needs to be removed. Sometimes you can give steroids to temporize the problem, but a neurosurgeon needs to evaluate this for surgery sooner than later. Do you have a favorite show that features medical situations that you want me to react to? Let me know which show or episodes in the comments below, or if I missed any Family Guy scenes that I should check out for another video. And as always, make sure you subscribe if you want to see more fun videos like this one. Thank you so much for watching, and stay healthy, my friends.